The Gait Guys. Case in 1 minute. The case of the curling toes. In this patient, left greater than right. What's going on? Why are his toes curling? And why are they curling more on the left-hand side? We've talked a lot about toes curling, and we always talk about a condition called flexor dominance. Flexor dominance is a condition where we have hyperactivity of the flexors and insufficient activity of the extensors, but most specifically, the long extensors. A common pattern we will see is people having weak, long extensors and strong, short extensors. To go along with this, a lot of these people will have strong, long flexors and weak, short flexors. Flexor dominance is often a cortical pattern caused from increased drive to the flexors and not enough to the extensors because we live in a flexor-driven society. So why are this gent's feet so asymmetrical? Perhaps it's because he has a leg length discrepancy. He is anatomically short on the left side and it's tibial. Can you see how the malleoli is higher on the left than it is on the right? His left short leg is evident here. You can notice that the left side is lower and he has a very subtle pelvic shift to the right side. He noticed this in the mirror, and that's why he came to see us. You can also see that the tissue folds are different on both sides of the pelvis. You'll also notice that he has one foot forward of the other. The right leg is the longer side. Oftentimes, we will see posterior rotation on the longer side and anterior rotation on the left-hand side. This is what we believe causes the differential in foot positioning. If you look very carefully in this view, you can see prominence and less of the sacroiliac articulation on the right than you do on the left side. You can also see some prominence of the right glute compared to the left. This is due to the posterior rotation. Remember, oftentimes with a leg length discrepancy, you have posterior rotation of the ilia on the longer leg side in an attempt to shorten the extremity, and anterior rotation on the shorter leg side in an attempt to lengthen the extremity. This a lot of times will cause a clockwise pelvic distortion pattern. Oftentimes, but not always, with a leg length discrepancy, people will pronate more through their midfoot on the longer leg side and supinate more on the shorter leg side. And in this particular case, that's what's happening in this individual. The left leg is shorter. As a result, he supinates more on that side. As a result of supinating more on that side, he needs to claw his toes to a greater degree to try to create stability. It's difficult to see, but he has a small increase in size of the first metatarsophalangeal joint on the left side compared to the right, forming a small bunion. we're assuming this is due to the supinatory moment of this foot and his inability to get that first ray down to the ground. So, when you see curly toes, we're going to think flexor dominance. When we see curly toes that are greater on one side than the other, we can think of a cortical lesion, but oftentimes, let's think of a shorter leg. Many times, they'll be more curled on the shorter leg side. So, what's the fix? Exercises for the long extensor tendons bilaterally. Maybe consider a full-length sole lift under the shorter leg side. How about some core exercises to strengthen the core? How about trying to decrease some of the pelvic rotation that we're seeing? These are all common scenarios, and we're sure you have your own way of treating these things. But next time you see curly toes on one side, think about leg length discrepancies. The Gait Guys. Thanks for joining us. See you next time.